episode of the Anti-Pharmacist podcast. I want to say Happy New Year to you guys, but I know that most of us, at least in Nigeria, are on public holiday. So I hope that you're enjoying yourself. To my Muslim listeners, I hope that you are enjoying your Eid al-Fitr break. And I hope you had a nice celebration. And this is to wish my colleagues, my professional colleagues who are medical doctors, happy Doctors' Day in arrears. Yes, yesterday was Doctors' Day, and I hope that you appreciated your doctors because they are doing a lot for the healthcare system in any country. All right. Yes. So happy Doctors' Day, dear doctors. We hope that you get the accolades that you deserve for your work in serving humanity and in saving lives from day to day. Yes, that being said, I'm here again to give you a very interesting topic, okay, to educate you on your health and medications as usual. But today, the topic I'll be discussing is on ear disorders. Ear, that is H-A-I-R, the one on our heads or on some parts of our bodies, okay? Yes, I found this topic very interesting and useful because a lot of people come into community pharmacies especially, or they go see doctors because of one ear disorder or another. There are many types of it which I'll be intimating you with very shortly on this episode, okay? And a lot of people, suffer from these things. Some are avoidable, but people do not even know why they are experiencing them. Well, you'll be getting to know today. Also, it has to do with body image, okay? Your ear disorder might affect your mental health, okay? The way people see you, the way you even see yourself. So it is very important that you take care on this front, okay? Do the things that you have to do to avoid them and take the right steps to treat them if you could not avoid them in the first place. That is what I'll be talking to you about today, and I'm sure that you will get value. So without further ado, let's just get right into it. So what are ear disorders? These are a range of conditions that affect hair growth, the texture of the hair, and scalp health. This includes hair loss, which is known as alopecia, excessive hair growth, which is known as either hirsutism or hypertrichosis, and some infections, especially fungal, that cause hair loss or bald patches on the scalp, okay? And common disorders include alopecia areata, androgenetic alopecia, and telogen effluvium. Alopecia is a broad type of hair loss, okay, in which there are bald patches all over the scalp. It can be from the front, they can be in different parts of the head, and there are three types, like I mentioned. There is androgenetic alopecia, which is male or female pattern baldness. It is a common hereditary condition that causes progressive hair loss, which leads to receding hairline in men and thinning hair over the entire scalp in women. For alopecia areata, it is an autoimmune disorder where the body's immune system attacks hair follicles, which causes bald patches and hair loss on the scalp, eyebrows, or even other body areas. While the telogen effluvium is temporary hair loss that is triggered by either stress, illnesses, childbirth, or some medications, where there is excessive shedding of hair in the resting phase telogen. That is a process of hair division. In that resting phase, the hair is shed excessively, okay? Then there is what we call traction alopecia. This is caused by doing tight hairstyles. This majorly affects women because of the mechanical tension on the hair follicles, which often results to receding hairline. And then there is the other type of hair disorder called excessive hair growth. It could be either hirsutism or hypertrichosis, okay? Hirsutism is excessive hair growth in women in areas where it is typically seen in men, such as the face. You see some women having beards, such as the chest and even the back. It is usually linked to hormonal imbalances. But for hypertrichosis, it is excessive hair growth on the body, not just in areas that are typically seen in men, but they are often due to genetic factors or certain medical conditions. There are other hair disorders that are caused by infections. Some fungal infections like ringworm, tinea capitis causes infection of the scalp that may result to itchy scaly patches on the scalp and hair loss as well. There's also bacterial infections like folliculitis, which is an infection of the hair follicles and can cause painful pus-filled bumps on the head. There is scalp psoriasis and seborrheic dermatitis. They cause inflammation, scaling, itching on the scalp, which lead to hair loss eventually. And there is trichotillomania, which is an impulse control disorder where individuals compulsively pull out their hair, which leads to patchy hair loss. This happens to people, but they cannot put a name to it. You just see yourself always wanting to draw your hair, you are removing your hair strands by yourself. This could lead to baldness, okay? And then there's eczema, which is a chronic skin condition that can cause inflammation, itching, scaling of the scalp, which can lead to hair loss. So these are the different types of hair disorders, all right? Now that you know the types, let's talk about the risk factors, okay? There are lots of things that can increase your risk of hair loss. One is family history of balding, either on your mother's side or your father's side. That's what we call genetics, okay? I've mentioned it, the male or female pattern hair loss, which is the androgenic alopecia. That is what it is. It's genetic. There's little or nothing you can do about that one. It comes with the genes, okay? But there's age as well. You know that as people age, the hair begins to thin, the hair follicles are more sensitive, and people start losing their hair. That happens with age. Then significant weight loss could also result to you losing hair. There is a science to it that when you lose weight too much, you begin to lose hair as well. One component of the hair is the collagen, and there is a way that your body actually affects the nutrient that gets to your hair. Then certain medical conditions also lead to hair loss, like diabetes, like lupus, they lead to hair loss. Then stress, some people begin to notice that they start shedding hair when they are stressed. Yes, the stress hormone cortisol actually has a function too in hair growth and maintenance or retaining of hair, okay? So when you're stressed, don't be surprised that you start losing hair, which is why you should reduce your stress, right? Then poor nutrition, that everything in our body needs nutrients, okay? For anything to grow, we need to take in the adequate nutrients, because even these hairs you're seeing, they're products of protein synthesis in the body, from your genes to the DNA to the production of proteins. All of them, they are involved in hair formation, because hair, the stranded cell, I told you that is collagen, and that is formed by aggregation of proteins in the body. So poor nutrition could lead to you losing hair. And there are also some medications that lead to hair loss. The most common ones are the chemotherapeutic agents. These medications you use to treat cancer, because they're cytotoxic, they affect your cells, they will affect your hair cells, they go straight to the cell division parts of production. I told you about telogen resting phase the other time. These medications actually affect that, okay? And so you see that people on chemotherapeutic agents lose their hair, although not all of them, but majority will eventually lose their hair. That's why you see them just barb the hair. They are bald because of this. Now that you know the risk factors, how do you prevent this hair loss? Okay, the ones caused by genetics, like I said, are not preventable. They just come like that, except a new drug is developed to take care of the problem from the genetic level, okay, which we're hoping for, of course. But for now, there's nothing to do about that one. The one for autoimmune diseases as well, if you're able to treat that autoimmune disease, it could prevent the eventual hair loss, okay? But for those that can be avoided or preventable, the likes of the ones caused by infection, the likes of the one caused by traction alopecia, let's talk about how to prevent them. The number one tip or thing to do is to be gentle with your hair. As a female or even a male, be gentle with your hair. Use detangler and avoid tugging when brushing or combing your hair, okay? Especially when your hair is wet. Use a wide tooth comb to prevent pulling out your hair. And avoid harsh treatment on the hair, like hot rollers, curling irons, hot oil treatment, and all of that. Limit the tension on the hair from different hairstyles, okay? You know, when you go to your hairdresser, women, don't be too scared to talk to your hairdresser when they are pulling your hair too much. You know, you see some hairstyles, the whole scalp will be standing like this. You see that this person is even uncomfortable, yet they will sit under a hairdresser and let them do that to their hair. When they do any braid for you and it's too tight, please let them know quickly to remove it and start again, instead of you carrying it home and not being able to endure the pain. You even have headache apart from the hair loss that will result. Some of them even lead to scalp infections, like you start developing pores, dandruffs, folliculitis from those kinds of hairstyles. So please be more careful, and also take care to let your hairdressers know that you do not just accept any chemicals. Be sure that you are sure of what is inside your conditioners, your shampoos. Also, you should reduce the use of dyes on your hair. There are times that it trends where you just tint your hair anyhow. You use different colors of dyes. That could be damaging your hair follicles and cause baldness later on. So please reduce the application of chemicals generally to your hair, because all these chemicals too, they have effect on your hair follicles and your hair growth at the end of the day. Okay, so meet specialized professionals that will treat your hair as it should be treated, gently and with utmost care. And if you're one that will take care of your hair by yourself at home, be sure that you do it gently. There are some people that have natural hair, there are some that have relaxed hair. It really doesn't matter as long as your hair is healthy. And how you can do this is taking extra care. Using heat treatment all the time will make your hair follicle more thinner, more fragile, and this could lead to hair loss. Okay, nobody says you should not relax your hair, but please be sure to use safe and gentle chemicals. Yes, that is it about being gentle with your hair and treating it with utmost care, knowing what materials or chemicals to use on your hair. Okay, also, if you're on any medication and you're noticing that your hair is falling out because of them, please speak to your doctor or your pharmacist about these medications and supplements that might be causing the hair loss. If there is a way they can substitute them for you or give you something to prevent the hair loss, they will do exactly that. Please always take note of the side effects of your medications. Okay, also protect your hair from sunlight and other sources of ultraviolet light. People may tend to ignore this, like what does ultraviolet rays have to do with my hair? It's just like exposing your hair to chemicals, like I said. So please always protect your hair from ultraviolet light. You know what to do with that. Yeah, wear or gears. I'm not saying that you have to always wrap your head all the time. Of course, you wear wigs. That might be a way of protecting your hair as well. But you know how you can do it, right? Just try as much as possible to not expose your hair to too much ultraviolet light. Okay, another thing is stop smoking. It's like smoking causes a lot of wahala that people who are smokers do not want to hear or care about. But it's the truth, because studies have shown association between smoking and baldness in men that smoke. A lot of them become bald at the end of the day. I say, it's not my concern, Jerry. What does smoking have to do with hair loss? Research has actually found a connection. So please stop smoking for your own good. Okay, and if you're on chemotherapy, I mentioned that the chemotherapeutic agents could cause hair loss. Ask your doctor about a cooling cap. There are cooling caps that can reduce the risk of hair loss during chemotherapy. So these are the preventive strategies. And of course, you know that you should eat well, exercise regularly, and all of that, so that your hair follicles get the right nutrients for growth. Okay, that is it about the prevention. Now, treatment for hair loss. There are medications for this. One is minoxidil. It's an over-the-counter medication which comes in either liquid form, foam, or even as a shampoo. For it to be effective, you have to apply the product on the scalp skin once daily for women and twice daily for men. And it helps many people to regrow their hair or slow the rate of hair loss. Or you can do both, but you will need to use it for at least 6 months to be able to see the effect. And it has its own side effects too, so you should not use it without the guidance of your healthcare professional. It could cause scalp irritation and unwanted hair growth in some parts of the body. So do not just use it indiscriminately. Always seek the advice of your healthcare professional. There's another called finasteride. It's a prescription drug actually for men. So it is taken daily as a pill. You should not get it just like that without seeing your doctor first. It also takes a few months before you start seeing the work. which is why you should be regular on your medications and not just to take it for a while and stop taking it. It also has its side effects, but it is more useful in older men, right? Because it actually causes diminished sex drive and some other risks. So do not take it also without your doctor's advice. The other medications, okay, like spironolactone, like dutasteride, but I just mentioned them so that you can know that they're actually drugs for these conditions, but do not take them without your doctor's advice. And worst case scenario, there's hair transplant surgery. We have seen people that have done it over the years. It is possible, okay, especially in cases of permanent hair loss or the genetic type. There's hair transplant for restoration, and it helps you to get your self-confidence back. If it's what you need, please do not hesitate to do it, but you have to consult your cosmetic surgeon or dermatologist before you make that decision, okay? And there are also toupees. You know what they call toupees? Those things that people wear cover the bald patches that look like hair. And there are wigs for some women. If you know that your hair loss is permanent, no medication is working, or the medication is not taking effect yet, you could use these toupees or wigs, to cover up so that you can improve your self-image before you start seeing the result of your medication. Laser therapy is also very much available and has been approved by FDA for treatment of hereditary hair loss in men and women. For those with hair disorders caused by infections, once the infection is treated, it is expected that your hair starts to go back. Alright, you could also explore natural remedies for treatment of hair loss, the likes of clove oil, of onion juice, of aloe vera, of different kinds of oil, coconut, castor, olive oil. But please do this with the consultation of your dermatologist and experts in that field. Don't just mix oils together and start applying to your hair. They could actually do more harm than good if care is not taken. Your pharmacist could also recommend supplements for you that could help with hair growth, the likes of biotin and some others that have been proven by research to actually help to grow your hair. You could also do scalp massage, okay, to help the blood vessels in your hair to get enough blood for hair growth. All right, these are all options that you could use to treat hair loss in the long run. Of course, for those that have excessive hair growth, hirsutism, you might have to always do hair treatment, shaving, taking particular care of those places where the hairs are growing, waxing, and doing all of that. Or if it's hormonal imbalance, you could visit your doctor, a dermatologist, to pinpoint the major hormone that is the culprit and help you to return that hormone to its normal level so that doesn't happen anymore. They know what drugs to actually prescribe to help reduce these things, right? So all these options are available for you. And for those that have the impulsive removal of hair, please seek professional advice, treatment to help you reduce that impulse of removing your hair. If you need something to distract you from it, please do that. That is what I have for you today on hair loss. I hope that you got value from this, and I hope that you will be more careful and look out for products that will help your hair to remain beautiful. The hair is supposed to beautify us, not to make us feel more self-conscious. So I hope that you take better care of your hair to improve your self-image. All right. And that brings me to the end of season 4 of the Anti-Pharmacist podcast. I've done a lot this season, but not as much as I usually do due to some glitches and some events, okay? But you know how it is. I promise you, in season 5, you will even get more value than you have gotten in the past 4 seasons. With your support, your sharing, your liking, your commenting, your reviews, your subscribing to my YouTube channel, I'm sure that you'll be able to help me take this podcast beyond borders to different countries, okay, to different people that actually need this information. And with that, the podcast keeps growing and giving value to people all over the world. I'm on social media, that is Instagram, TikTok, Facebook as Anti-Pharmacist Podcast, on X as Farm Podcaster, on LinkedIn as Bimisola Debisi Jose. Please reach out to me on all of these. You can reach out to me via DM. You can also mail me at antipharmacistpodcast@gmail.com. Thank you so much for your support thus far. See you in season 5. Till then, stay healthy and God bless you. Bye.